Now it's time for TIPisodes with quick tips you should know. Techniques you can implement into your workflow right here on A Tale, oh yeah, A Tale of Two Hygienists.
Hello, everybody. My name is Bethany Montoya, and I'm a clinically practicing registered dental hygienist. During this TIPisode, I want to discuss the importance of advanced plaque biofilm removal techniques in our patients undergoing oral appliance therapy. In my role as a dental hygienist, I have a pretty unique opportunity to serve in a non-traditional capacity, providing oral appliance therapy at a dental sleep medicine practice based out of Fort Worth, Texas. Our appliances treat a variety of conditions, but mainly revolve around treating snoring, obstructive sleep apnea, and TMJ disorder. Some of our appliances are only worn at night, while others are worn both day and night to treat whatever condition our patients are suffering from. In providing oral appliance therapy for so many patients in my local community, I've really come to the realization that an increased need for thorough plaque removal before our patients insert whatever appliance they wear, whether that's an occlusal splint or a night guard, a mandibular advancement device, an orthodontic retainer, partial denture, or even clear aligners. Anything that our patients are routinely placing in and out of their mouths will not only harbor disease-causing pathogens, but will seal pathogens in place that weren't removed during their oral hygiene regimen. We know that plaque bacteria is the cause of both tooth decay and periodontal disease. And when an oral appliance is inserted into a mouth that is not effectively cleaned beforehand, that biofilm thrives, and we don't want that. While I worry about my patients' risk for decay due to improper oral hygiene, I especially worry about their risk for periodontal complications, as a lack of oxygen and salivary flow can feed gram-negative anaerobic bacteria covered by an oral appliance. Over the more recent years, we've learned that certain oral hygiene aids are more effective than others in helping to obtain optimal health in our patients. The standard brush and floss daily mentality has been proven less effective in clinical studies as opposed to more advanced concepts like using an electric toothbrush, using interdental brushes, or water flossers. And on the topic of water flossing, studies published in the Journal of Clinical Periodontal in 2018, the Journal of Evidence-Based Dental Practice in 2020, and again in the Journal of Clinical Periodontal in 2020 communicated that water flossing is superior for reducing gingivitis and bleeding upon probing when compared to more traditional methods like string flossing and chlorhexidine rinses. As a dental sleep medicine provider, I also take concern over my patients' systemic health, as I know that many conditions and comorbidities are related to their sleep-disordered breathing. When our patients are continually exposed to dysbiosis within the oral microbiome, these pathogens, they never just remain in the mouth. We know they move around. We know that periodontal pathogens have been proven to be related and sometimes even causal to conditions like heart disease, pneumonia, diabetes, dementia, and even certain cancers. Our goal as oral healthcare providers is to assist our patients in minimizing their biofilm levels in an effort to halt the transmission of disease-causing bacteria throughout the body and to decrease the number of inflammatory biomarkers that lead to life-threatening illnesses. Many of these comorbidities have a bidirectional relationship with our patients' oral health, but in my practice, I also worry about how they amplify my patients' risk for sleep-disordered breathing. While it's true that there are some individuals who can develop obstructive sleep apnea with no known underlying medical conditions, we do know that the presence of things like metabolic disorders, specifically hypertension and diabetes, or things like cognitive decline and lung diseases, can cause serious issues in our patients' sleep health due to a change in cardiac function, hormone release, and neurological processes. When it comes to effective plaque biofilm removal in our patients undergoing oral appliance therapy, water flossing, it really can't be underestimated. taking the time to counsel and empower our patients with education so they can be successful in their home hygiene attempts is crucial in maintaining both oral and systemic health while the appliance is being worn. The Waterpik Aquarius is a fantastic water flossing tool that patients can use to set themselves up for success during oral appliance therapy. This model is really great for first-time users with its simple, easy-to-use design and is ideal for patients who have a variety of dental restorations like implants, crowns, bridges, and cosmetic work. It's available with a variety of tips so the patient can really cater their flossing experience to their unique mouth. There are tips made for cleaning periodontal pocketing, orthodontic brackets, and implants, which makes it possible for patients to effectively remove plaque around any structure. It also has an easy-to-use dial to adjust the water pressure to the patient's comfort level, which I really like. I always recommend patients who are new to water flossing to start on the lowest power setting and gradually increase it over time to their liking. Plaque biofilm, it's really no joke, guys. It can quickly take our patients from a state of health to a state of chronic disease. For those who are undergoing oral appliance therapy, there is an added risk for biofilm retention and progression. Each of our patients requires individualized home hygiene recommendations, and while a water flosser has been shown to be beneficial for virtually every patient, those who wear removable devices must go the extra mile in thorough plaque removal. I hope this tip was helpful. If you're wanting to connect with me, you can find me on social media with my account handle, HumanRDH, or by emailing me at humanrdh@outlook.com. Thanks, guys.
A tale of two hygienists.